My name is Rajesh Padmanabhan. Most people call me Dr. P because my name is so long. It's a long South Indian name, and that started kind of in the Air Force. I was a major in the Air Force, and they called me Major P, and that transferred as a physician to Dr. P. And I have a practice in Arlington and Dallas, and I get patients from around the Metroplex. I'm a general surgeon, and I've been practicing here in the Metroplex for about 12 years. My parents immigrated here when I was 5. And I grew up in Kansas and went to school after high school to a 6-year medical program, UMKC. And I did my general surgery training also at University of Kansas. And then the Air Force paid for my medical school. So I, after my residency, joined the Air Force and was a general surgeon in the Air Force in St. Louis at Scott Air Force Base. I had one deployment in 2003 to Turkey, so I operated in Turkey for a few months, and that was exciting. Took care of the troops there during Operation Northern Watch and things like that. So we would get troops, obviously there wasn't a war in Turkey, so we would get troops from Iraq and Syria, and they would be brought to our base. And so just the variety of trauma and non-traumatic surgery we did there was fantastic. Things that I wouldn't see in the Metroplex. Also developed a great relationship with 2 Turkish general surgeons, and I would operate at their facilities, and just seeing the differences between first world, third world, and how they, reused everything. They'd reuse their gloves and wash them, and things that we would just not even experience. It was a neat experience for me to operate with them. They didn't have the advanced laparoscopic equipment we had, and it was fantastic. Just meeting the people and operating over there and seeing a different world was great for me. My grandfather was a doctor in India. I would just follow him to clinic, his family practice clinic, and I just loved it. I loved hanging out with him. I loved seeing patients with him. And being in obviously a third world country, when he came home after he ate, he spent another 2 hours just taking care of indigent patients, the patients that had no insurance. And I just thought he was the greatest, and that ever since then, that's the earliest memory I have that I'm going to do what he did, and so I think he was my inspiration to go into medicine. I went into general surgery really because of the amount of things a general surgeon can do. I thought about ENT, I thought about ophthalmology and things like that when I was in medical school and deciding on residencies. And I thought, well, I don't want to just operate on the eyes all day. I want to do a broad base of surgery, and general surgery really offers me that. I can be doing advanced laparoscopy one day, I can treat breast cancer the next day, I can do thyroid surgery the day after. I'm really able to take care of a lot of surgical issues for my patients. And I have patients that come in and see me for their thyroid nodule, and I'll operate on it, and then 2 years later a family member had breast cancer, or they need their colonoscopy. So they get to know me, they like me, we have a personal relationship, and they feel comfortable with me where I can take care of the whole family's surgical needs, and I just love being able to do that. My practice is inpatient and outpatient. There's a surgery center, and I have a procedure suite in my office. I'll do office-based procedures, sometimes on hemorrhoids or lumps and bumps or pus pockets, little moles, anything I can do in the office. Larger procedures we do at the surgery center. It's an outpatient facility. It's a very nice facility in Arlington, and obviously that's day surgery. They just roll in, roll out. For larger cases, I operate at multiple facilities in the Metroplex, Arlington Memorial Medical Center of Arlington, also Walnut Hill Medical Center in Dallas. So larger procedures we'll do at the hospital, but it's amazing now with laparoscopy and all that, most procedures can be either done in my office or in a surgery center. I'd say things I'm passionate about: travel, golf, skiing are probably 3 of my passions. I love golf vacations, and we took a golf vacation last couple of years to Ireland and to Iceland. We golfed Iceland, golfed Ireland, so that's always exciting for me. A couple of years ago, went to Machu Picchu, which was exciting. Last year, in June, we went to Spain and went to Pamplona, and I ran with bulls. You work so hard when you're in town, it's nice to get away and do something fun and just something completely different, and that's what I enjoy doing. As far as standards in medicine now, you have to monitor yourself and everybody around you, or basically you're not going to get paid. I mean, you're going to get paid based on standards, and I think that's great, and we welcome it in medicine, and that's what we want. We want people to come to us because we know we have high standards and nothing to hide. And And I'm proud of our facilities because we don't allow in our surgery center or the hospitals I go to anybody that's not board certified, that's not adequately credentialed with background checks to double check what they say is true, what procedures they've been trained in, have they been trained in. We don't allow somebody to go to a weekend course and come and do laparoscopy at our center. That's not good enough. Some people will get a certificate from a weekend in California. That's not good enough. We need to know that you've had adequate training to do the procedures that you do. I love Top 10 MDs. I love that we have an organization that helps patients navigate the internet. If you go on the internet and type something out, it's too much. I get lost. I look at physicians even that I know and I'm completely lost. We need a third party that's independent, that helps patients navigate who to go to, what are the issues, and these are surgeons that they've helped to vet so you can have confidence in who you go to see, that hey, I'm not just blindly looking through the internet, I have a partner in helping me find the right doctor.